Back, everybody, for our roundtable discussion. You have Joe Messino and I. We're going to be talking about adverse effects of the most prescribed medications. My gosh, we could probably talk for 3 hours on this, Joe. But we'll keep it pretty poignant and, probably just go with the, most prescribed and most serious effects. And then some of the less serious that have been normalized, which I think are probably more dangerous now.
Yes, normalized. That's a bad word.
That's a bad word. That's normal, Joe. That's totally normal.
Oh, you're just getting old. It's okay. That's normal. That's
Right.
just a mild side effect. Okay, everybody needs to know right off the bat. If you haven't heard this before, I'm going to say it again until everybody gets it. There's no such thing as a side effect. Right? No such thing as a side effect. That is a marketing term. That's a marketing term, just like good cholesterol and bad cholesterol. Those are marketing terms. Okay? You guys know that? You knew that. Well, I know you knew that because you've heard me say it. Okay?
A million times.
A million times, yes. So there's no side effects. There are only direct effects from these chemicals, period. That's number one. And, I think that it's that blind faith again that's killing us, right, Trace? It's that blind faith in the doctor that he's going to just give you something that'll never hurt you and it's only going to help you. And, that might have been true at some point, right?
Yeah.
First, do no harm. Let medicine be your food. Let food be your medicine. That was a long time.
Well, that was before the introduction, I think, of the pharmaceutical reign. And, here's the other thing. It's blind faith by the doctor to just take the word of the pharmaceutical rep.
Yes.
Has that ever happened to you, Joe, that you walked into an office and you were like, hey, I'm going to rep this nutraceutical product and it's the best. And you should give it to everybody that has this condition, regardless of age, regardless of health, regardless of anything. You just give it to everybody at this level. And the doctor literally went, oh, okay. What normally happens? They do that? They take the bottle and they're like inspecting it. And they get the magnifying glass. And then there's 50 questions on every ingredient. And then they get an equivalent product and they look at it and they compare it. And then they ask you why. Then 47 questions later, they may buy 12. That's what happens. Well, but in pharmaceutical, they're like, here's the magic pill. And this is one research study that had like 27% efficacy. So therefore, it works for everybody. Let me know. And here's your free stethoscope. Thanks for playing. That's what it's like.
Well, part of the problem is that pharmaceutical company that comes in and says, here's the new drug, you should give it to all your patients, is the same one that funded their medical school.
Mm-hmm.
So that's part of the problem. They're already familiar with them. There's already a built-in trust. They got them to this point, and they're going to follow the formulary. It's that simple. They're going to follow the formulary. Now, when we start talking about adverse effects, their adverse effects are anything that is detrimental to your health. And that could be muscle pain from a statin,
right,
to death from chemotherapy. Okay, because that's a side of. Did I say that? That's a direct effect of chemotherapy. Is death.
Yeah,
I know.
Well, the direct effect of muscle pain and statins, people just brush that off like that's nothing.
Yeah,
like they're like, oh, it's just normal. It can be life-threatening because remember, your heart's a muscle.
Mm-hmm. You're right. Yes, your heart's a muscle, and it needs energy, and that energy comes from CoQ10. CoQ10 is made in the same chemical pathway as cholesterol. So when you prohibit that production of cholesterol, you prohibit the production of CoQ10, and the heart muscle gets weakened, the leg muscles get weakened. Every muscle gets weakened. Then, not only that, when you stop the production of cholesterol, well, guess what? You can't make vitamin D.
Mm-hmm.
If it's not in abundance, you can't make brain cells. If vitamin D is not in abundance in your skin, you can't. Cholesterol is not in abundance. You can't make vitamin D from the sun. And cholesterol is a mother hormone, so it's responsible for making testosterone. guys. So if you're having problems in that area and you're on a statin drug, bingo.
Well, isn't
That's
that
it.
a
There's
muscle
cause
too,
and effect.
Joe?
What's that?
Isn't that a muscle?
Yes. Well, yeah.
Okay,
I
so you
guess
got
it is.
two issues.
Yeah.
You have low
And then,
testosterone and low
yes.
CoQ10, which leads to
Right.
the breakdown of ATP and what you need for
Mhm.
muscular strength. So now all muscles are weaker. You're having pain in all muscles. And this
Yes.
is a real thing because this is a pattern of prescription and people don't even think about it. I mean, at the very least, take a CoQ10 if you're on a statin, at the very least. And then figure out that cholesterol is a good guy, not a bad guy. And then figure out that cholesterol is an alcohol that binds with good fats to make brain, to make cells, to make vitamin D, to make hormones. It makes so many things in your body. Why would you want to reduce it? So, but that's the allopathic treatment. They don't ask you, oh, do you have a good diet? That may be inflammation in your body. That's why your cholesterol is high. Are your hormones
They don't
balanced?
ask.
Maybe that's why your cholesterol is high.
Right.
No, they don't ask. They just here's your script. Oh, and when you come back for the next visit, because of your insurance reimbursement and the way it's set up, and lobbyists in Congress trying to make sure that your insurance only pays for certain things if there's certain drugs prescribed. The next time you come in, I'm going to have to prescribe you a blood pressure medication as a preventative, just in case.
Just in case. And then, of course, if you're a cardiac or cardiovascular patient, you're going to get the trifecta. You're going to get blood pressure, cholesterol, and blood thinners.
Right. Or if you're a diabetic,
and
you get the trifecta.
And you get that one. You'll get the
metformin,
right?
BP, and cholesterol.
And then I just had somebody come to me about. She said my brother, is having problems in the bedroom. Okay, and so she says
it's weird for her to know, but continue.
Yeah, he came to her. Well, she's also a health coach, and she said, "Can you, She came to me and she said, "I'd feel more comfortable if you would, tell him what to do." And I said, "Okay."
That one threw me a little bit for a minute. Go ahead.
Yeah. So I said, "Yeah, no, it wasn't like that." But I said, "Okay, well, what meds is he on?" "Oh, I don't know. He's not on that many." "Oh, okay. What's he on?" "Well, he's on cholesterol." "Okay. He's on blood pressure meds, and he's on Plavix." I said, "Okay.
Not that many."
Now, you need blood flow. Okay. Let's get right down to the nitty gritty. For a strong erection, you need blood flow, and you need strong blood flow. You can't get that if you're on a blood thinner.
You're gonna get us
You
banned.
can't get that. You can't get that on blood pressure medications.
Right.
Okay. That softens and doesn't harden. Okay. And then on top of that, you take the cholesterol med that's stopping CoQ10 and prohibiting testosterone. And man, you have a disaster on your hands.
Mm-hmm.
A disaster in the bedroom. Right.
A disaster in the bedroom. And then, if the happy wife, happy life, guys, that's just what we say and we mean it. So I just want you to understand. So I want to share this consumer health alert that is actually on the Nutritional Frontiers website. And you can probably get these at the Weiner Wellness Center. But these are nutrient depletion from prescription medication, also over the counter. Let's not forget over-the-counter medications also come with a panel of depletion, and they're probably more dangerous because they're not monitored at all. You can just go get your Zantac. You can just go get your Allegra, and you can take it and take it and take it and take it. And like Jamie said yesterday, well, I guess they didn't really mean it when they had the cardiovascular studies with Zantac. Like, it's back out there again when we found that all those people were killing over. But here's your drug, antacids or ulcer medication, including Pepcid, Tagamet, Zantac, Prevacid, etc. Your nutrient deficiency, probiotics, betaine hydrochloride, folic acid, vitamin B12, vitamin D, calcium, iron, zinc. And let's look at the potential health problems that happen because of it. Anemia, depression, tiredness, increased cardiovascular risk, birth defects, cervical dysplasia, heart disease, cancer, osteoporosis, muscle weakness. I mean, Joe, this sounds like a cure to me. I don't know, a cure
for a quick
entrance into the grave.
Yeah, who would read that and say, "Okay, I'll take this"? I don't understand. Well, first of all, they're not reading it. They're not
They're
reading
not
it.
reading
Again, it's that blind faith, trust the doctor, take the prescription. On my meds. I'm on my meds. And it's like, it's almost, I don't know. I mean,
So tip number 1, read the insert,
read
right?
the insert.
Read the insert. Let's take a look here. Now, antibiotics, probably one of the biggest prescribed next to contraception. Here we are again with our deficiencies, probiotics, B, K, calcium, magnesium, iron, B6. Here's convulsants, D, calcium, folic, biotin, carnitine, B12, B1, K, antidepressants, anti-inflammatories, all of these things. And the NSAIDs, those are super dangerous, the non-steroidal anti-inflammatory drugs.
Yeah.
They're very dangerous. Here's antiviral. These are, drugs that are given. And, honestly, these are probably less given, but still, if you do take them, my suggestion is, number 1, read the insert. The second suggestion I would have would be, if you know what the deficiency is, then take that thing, right? If you know all of these deficiencies happen, then maybe take a really good multivitamin. Maybe take probiotics while you're taking antibiotics. Like you said with statins, why not take CoQ10 if you're on a statin? So I think the first thing we have to teach them is read the insert. The second thing is what to take.
Right. Well, you take everything that's in the deficiency column because there's a pattern. Okay. The number one, the big nutrients that are depleted are probiotics, B vitamins, CoQ10, vitamin D, and minerals. They're all, isn't that part of, like Jeff says, the 90 essential nutrients? That's all there. It depletes nutrients. Look at the title, nutrient deficiencies. This is what it causes. And it's not that we don't already have these deficiencies from our diet.
Now you just have them more.
Now we have them more.
Yeah, there's your cholesterol drugs.
You mentioned birth control, and I think that's probably one of the most overlooked. If I'll talk to somebody and say, what meds are you on? I'm not on any. Are you on birth control? They say, yeah. Well, that's a med.
Well, right here's female hormones, estrogen hormone replacement. So estrogen hormone replacement, which we think is like, I'm on bioidentical hormones, so everything is perfect in my life. Well, here's all the deficiencies that are happening. Here's over here some of the side effects of those deficiencies. So we still, even with bioidentical hormones, hormone replacement, or oral contraception, you have to replace what's being depleted. And in the health histories, I don't know if this is relevant for you or any of the practitioners there. When I ask somebody, like, are you taking medications? They're like, nope, not one. Oh, okay. And so I go to menstrual cycles and I ask about, are you having healthy menstrual cycles? And they're like, well, yeah, I'm on birth control. And I'm like, I just asked you if you were taking any prescriptions. And you were like, nope. They don't consider it a prescription for some reason.
No, I know. It's crazy. And it's gotten, I think, to the point too, where like those top 3 or 4, they've almost gotten into that same category: cholesterol, blood pressure, blood thinners, and the blood sugar,
statins,
metformin. Yeah,
no,
they've almost gotten into that category of HRT, where they're just, these are just natural for me to take when I get to a certain age, and that's the way it is. If you go to a doctor. If you go to a doctor with blood sugar issues, their formulary actually says gives cholesterol and blood pressure medications if they have a blood sugar issue. Why? Somebody tell me why. I don't know. I can't think of a good reason.
Well, I'm not sure why people have to be on cholesterol medications if they don't have high cholesterol. I don't know why they have to be on with high cholesterol, but let's say you go in and you don't have high cholesterol. And they'll prescribe it to you as a preventative. Like, a preventative what? Is that going to keep you from eating the Big Mac? Like, that's the preventative pills that should be given out. Like, this is your anti-Big Mac, and this is your anti-SAD diet, standard American diet. Like, why would we come out with those pharmaceuticals?
Well, I remember looking up, and you can do this on the U.S. Government Patent Office website, USGov or USPatent.gov, I think it is. And you can look at the original patent for Lovastatin. And that was the first one, 78, 79. And in that patent, it has as an ingredient coenzyme Q10.
Hmm.
They knew
So why
that.
did they take it out?
Yeah, because of follow the money, because of the cost. Yeah, because of the cost. So they knew then, and even if they didn't put it in the drug, Tracy, what if they just put it in the instructions, right? Anytime you prescribe CoQ10.
Well, isn't it illegal in other countries, like in European countries, that
Yes, it
they
is.
have to prescribe a CoQ10 with a statin? I mean, not in this country, but other countries,
Yes.
So that's where we have such a dichotomy of what true health is. And
right.
I mean, I feel there's an awakening coming, like where people are going to be like, wait a second, symptom-free in the presence of pharmaceuticals does not equate health. Dr. Sherry Tenpenny once said, which was a great line.
Great quote.
And, we have to take that seriously. All we're doing is dumbing down our body's response to things and ignoring signals that are early indicators that there's something wrong. And then all of a sudden they're on a cholesterol med and maybe a diuretic and a blood pressure pill and then something for their sugar levels because now their endocrine system's out of whack. And all of a sudden they have a heart attack, or all of a sudden they get diagnosed with cancer and they're shocked. They're just like, it's just all of a sudden.
Well, the number one adverse effect for diuretics is mineral deficiencies. Complete depletion of minerals for diuretics. And you got lots of people on diuretics out there, and they could do it naturally. We have lots of things here that will help, but it will not deplete your minerals.
But the number one reason people retain fluid is because they're mineral deficient in the first place. Right. And then they add a diuretic and it's like 10 times worse. So again, if you guys know, or you're on medications, we're not saying stop your meds. We're saying add in the nutraceuticals that the medication is depleting. And then step 3 would be educating your doctor. I mean, I think sometimes people get afraid to tell their doctor, like, oh, I went to see this natural health person and they gave me these nutrients. Doctors truly don't know. They're not taught nutrition in med school. They should be, but they're just not. So they're taught pharmacology, they're taught symptomology, they're taught how to take blood pressures, how to run certain tests, how to interpret data, but they're not taught lifestyle and how to really practice chronic healthcare, right? So forever healthcare. They're disease management at the acute phase at best. And sometimes they appreciate the education of like, hey, doc, I was on this statin, I was having a lot of muscle pain and blah, 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 blah. So I started taking some CoQ10 and it went away. That happened with my kid's pediatrician where I was like, hey, here's what I think about this. And he was like, oh, so he started to recommend that to people. So I had COVID and was in the hospital 10 days and now having a lot of stomach issues from all the drugs. Yeah, I'm sure. Yes. GI Complete can be very helpful in that, Janice, along with some probiotics, just to reestablish your flora and to reduce some inflammation. And yes, if they were giving you pain pills, they were giving you NSAIDs, yes, just make sure that, you stay in touch with your doctor. If it gets worse, you want to make sure that they take a look there and make sure there's nothing else wrong. So
everything starts and ends in the gut. So if that's the issue, then you're right. GI Complete has to be first. You have to repair it, and then you fortify with probiotics, and then you help the assimilation of nutrients with enzymes. You got to do all 3 steps. You got to do all 3.
Yes, and it makes a tremendous difference within days. So, so I think we talked about the cardiovascular route. We've talked about some digestive things, oral contraceptives. These are big ones that are out there. Let's talk just in the last few minutes about allergy pills, especially over the counter, and what you see with those, Joe.
Well, you see a very, very quick dependency, very quick dependency on allergy medications. One of the quickest of all of them, especially the over-the-counter ones, because people just take them. There's no guidance, and they start to depend on them. But with the allergy meds, you're getting synthetic histamines, and that's not good. What you want to do always is stimulate the body to do something, not do it for the body. So you don't
Mhm.
want a synthetic histamine. You want to stimulate the body to make histamine. That's the proper pathway. And when you take allergy meds, it takes the place of that process. It eliminates it. And then before you know it, you come to depend on it. And I
Yeah.
think people get hooked on allergy meds quicker than anything else out there.
And kids
Yeah.
especially. And then they're kind of like zombies without them because they're such a stimulant. So it really has a bad effect. I mean, like taking something like Allegra every day, you know, it's hard on
Mhm.
the liver. It's really hard on the liver. You know, when I used
Yeah.
to do RBTI testing, if I had someone's liver panel show up as like a 0, like it wasn't even testing out, the very first thing I would ask them, are you on allergy meds? And they would always say yes,
Mhm.
100% of the time. So it's
Well,
super
that's a good point,
detrimental.
though, Tracy, because any medication will elevate liver enzymes
Hmm.
because your liver is working overtime to process the chemicals.
Yeah,
They're
absolutely.
going to elevate liver enzymes, no matter how you look, no matter what it is, it's going to. I
Remdesivir is
want
way too much steroids in, but I could feel
yeah.
my liver was inflamed, thought my pancreas was too. I've been doing probiotics surgery, and they have really helped. Yes, absolutely. We did a whole thing on remdesivir. What was it? Monday on the
Yeah.
roundtable. You may want to go back and catch that because that medication that should be pulled from the market. I mean, from the initial
Mhm.
study, that stuff is not good. So one of the things that I would probably suggest is make sure that you're doing some CircuCore, Janice. That's going to be very helpful to you. You need some more nitric oxide in your system and some repairing
Yeah.
of that endothelial tissue. So,
Yes.
but good
Go
stuff.
back. Let's just go back real quick to cholesterol for a second
Mm-hmm.
because it's a very hot topic for me. Always has been, and we're not saying that if your cholesterol is 400, don't ignore it. We're not saying that.
Right.
That means something else is wrong.
Mm-hmm.
Okay, you're not making too much. Your body's not processing it properly.
Right.
That's a deficiency. It's an antioxidant or a vitamin deficiency. You have to address it on the back end, not the front
Mm-hmm.
end. And that's where they go wrong.
That's a great
So if
point.
it is that high, yes, there is a problem.
Yeah.
Okay, but
And
it's
if you
probably
have a cholesterol of 400, it's telling you that there's a need for cholesterol, there's a need for something. But what's it bind with, right? It binds with a good fat. That's why
yeah.
by simply increasing your omega fatty acids, they have shown that it reduces cholesterol because that's who it binds with. And then it gets carried off and it goes make a hormone or it makes a brain cell or it repairs a cut in your system because it's an anatomical Band-Aid. The issue is you want to stop whatever's causing the cuts. You want to stop whatever's causing the depletion of brain cells. You want to stop whatever's disrupting your hormones. So then cholesterol doesn't have to come out with a vengeance. Your body just doesn't decide like, oh, well, it's Wednesday, it's cholesterol Wednesday, let's just jack it up. It doesn't do that. You're usually deficient or your diet is high in oxidative stress and it's causing damage.
Right.
And that's where someone at the World of Wellness can really help you. And the Oligo scan, Joe, you could do an Oligo scan. Tell us about that.
The Oligo scan. Yeah, well, it's our newest tool here, and we like it. We're getting a lot of people taking advantage of it. It's a measurement using light photography in the tissue of your hand, and it measures 21 minerals, 15 toxins, and 7 vitamins, and other markers as well. So on Saturday at noon, we're going to be doing a Oligo scan on Saturday at noon on the final workshop. So
that's
we have
great.
we have a volunteer lined up.
You do. Uh-oh.
Yes.
Surprise
Mikey
guest.
G.
Oh no.
Mikey G.
Yeah. it's like a galvanic skin.
If it's not too
that thing's
busy
gonna
here,
blow up.
if it's too busy here, we won't be able to use them. But we'll get another volunteer to do it.
Yeah,
but,
absolutely.
yeah, we're gonna do a live Oligo scan on Saturday at noon, so everybody will get a chance to see it.
Good, Janice. You can find that recording from what did we call it? It was COVID treatment or medical treatments in a COVID world.
It was medical treatments for
in a COVID world. Yeah. So you can find that on the Facebook page or on YouTube. They're in both areas. Just look that up. It's called Roundtable. It'll look just like this one did with a different title. So guys, our point is that, strategic use of prescriptions is fine. There have been times that they have saved lives. We are not denying that. We're not denying that they have good purposes, but they're not meant for chronic care. They're just not. And lifestyle is normally the key. And I know it's a bigger change than suppressing a symptom, but it's also, a life-altering change that can give you quality and quantity in years. So make sure you read those inserts. Make sure that you're taking what the depletion says. And if you need that consumer health alert, I'm sure the Weiner Center can get that for you. And then educate your doctor, educate, your family members on what worked and what you're doing. Share that knowledge because it can be life-saving for somebody.
Right. And we didn't even get into antacids. Wow, what a problem there is out there with those.
Well, you can
Listen,
get into them.
a little bit, but you still have time?
Yeah.
Okay. It just blew me away when I saw the commercial with Larry, the cable guy. He was pushing Prilosec, I think. One of the purple pills. I don't know which one he was pushing. But he said, I just take my Prilosec and eat whatever I want.
Mm-hmm.
That's
the mindset.
It shows, Larry. Okay.
Yeah.
You do. Yes. But that's what people want. They want to be able to do that, take their drug. But the long-term impact of those things, and it doesn't even take that long. Even take that long. You reduce acid like that. We need acid. Tracy, how many times have you seen people when you're in practice that think they have low acid when they really have, think they have too much when they really have low acid?
Pretty much 100% of people that are on acid reducers.
Right.
Because that's what they're told. Their doctor says your acid's too high. Guys, if your hydrochloric acid was coming up in your throat, you'd have a hole burnt through your chest. It's not, so it's that is acidity, but it's not because the acid's too high. It's because you're not producing enough and the food sits in the digestive system too long and doesn't activate the next phase of digestion. Probably because you have inflammation, probably because your body doesn't like what you're eating. So instead of reducing the symptom and telling that screaming child to shut up, you might want to change your diet and eat things that are more beneficial to your body and whole foods. What's the insert say? How long should most antacids be taken, Joe?
48 hours max.
Mm-hmm.
Max. Yes, not longer. People take them their whole life.
Yeah. And I think some of them say 2 weeks and that it is recommended you stop completely. But guess what? You're not reading the insert. Your doctor's not telling you. He doesn't have time to read all the literature. Right. Over the counter stuff. Yeah. So even if it is over the counter, plus all of those deficiencies, and the biggest deficiencies caused by antacids are B vitamins because they lower your hydrochloric acid. They're going to lower your assimilation of protein and amino acids, which is where your B vitamins come from. So you're going to get low energy. You're going to get high cortisol. You're going to get low brain function. You're going to have mood issues, serotonin, dopamine, protein. You're not going to be able to make collagen in your body. Your heart muscle will get weak. Your joints will get weak. And all because you want to keep eating the pizza. Like, drop the pizza. There's a nice cauliflower crust out there. Try going that way. Some real raw cheese on there, right? Non-nitrate pepperoni. You can have your pizza. Just make it real. So
yes,
you got to come see Ashley for cool recipes like that.
Yeah. Yes, she's got some great recipes, and she uses some great flour alternatives. I know cassava flour is a big one that she likes. And there's other ones out there as well. You don't have to use wheat flour.
No.
Okay, wheat's toxic. You don't have to do it. So even those healthy ones, even cassava or these shouldn't do it in excess.
Mm-hmm. If you're having issues and they're taking an over the counter, I always like Probzyme to use intermittently until they can wean off that over the counter. This sounds so counterintuitive by chugging a shot of Bragg's. Yeah, there you go. As a chaser, it really does help with acid reflux. Absolutely. It's loaded with B vitamins, guys. That's what's in Bragg's. And so it's going to activate the pathways of neurotransmitter digestion, which is part of the enteric nervous system. So guys, there's always a reason. There's always a reason. Our bodies are set up beautifully. I love Probzyme, probiotic enzyme. Go in there. You can use that as you're adjusting off the Tums, as you're adjusting off those over-the-counters. Works really well. Those are some of the things that you can do. Take your CoQ10. Take your good multivitamin. Make sure you know what's being depleted so that you can replace it. Your probiotics, things like that.
Minerals, CoQ10, probiotics, B vitamins. They're the top ones.
Yeah.
They're the top ones. And D is right up there with them. So if you're not taking, you should be taking those anyway, like you said. Everybody should be. We can't get them in our food supply. You should be taking those. That should be a standard supplement protocol. B vitamins, CoQ10, magnesium, D3. It's got to be there. A good B complex like Super B Complete. It's just, it's simple and easy.
Well, I would invite everybody down to the World of Wellness to make a session with Joe if you're on any prescription medications and right now not ready to make the leaps and bounds of lifestyle change, but you want to help your health right now. Go get an Allego scan and find out where your deficiencies are and fill the gaps for right now.
Right.
That would be the best plan you could possibly do.
And that's that.
And that's that. Can quercetin make stomach hurt? If it is making your stomach upset, it might be because your stomach's a little bit irritated right now from the medications that you mentioned, Janice. Just take it with food and cut down the dosage a little bit until that stomach lining heals. But I think if you get a little bit of that GI Complete in there, you'll be shocked at how quick that works. So many good soothing herbs in there for inflammation and repair.
Yeah, definitely.
Good stuff.
And many times, I know with like things like fish oil, if people burp it up, I always tell them to take it before the meal so that the food is on top.
Yeah,
and that
that's
helps.
a good suggestion.
Yeah.
Well, Joe, thank you so much for being here and sharing yet again all your knowledge and wisdom.
Pleasure.
Say a prayer for me.
Always a pleasure.
All right, guys.
See you tomorrow morning.
We will be here 8:30. Well, you'll be there. I won't.
Phil's giving me the live long and prosper sign.
You and Phil and Jamie streaming live. So thank you guys so much. Have a great day. Join us back here at the World of Wellness. Weiner Wellness Week is live all week long, in-house, online. Stop in, get your samples, talk to the team. It's awesome. We'll be back at 8:30 tomorrow morning.